So this video is going to be composite number 1 for skills. This is going to be an occlusal composite in the posterior. So the first step is always going to be that mirror and explorer. So the mirror the dentist will keep, and then the explorer will verify what tooth we're working on. And then in most cases patients do want to be numb, so you're going to use that cotton tip applicator again with the topical anesthetic, and then you will pass the correct aspirating syringe. If it's blue, it'll be for maxillary. If it is yellow, it'll be for mandibular. Once they're numb, you're going to use the high-speed handpiece, and you'll use the HVE, and then slow-speed handpiece to remove the decay, and again the HVE. And then just like amalgam, the next step will be that spoon excavator. That is to make sure that all of the decay is out. Now, with composite is different. It's chemically bonded into their tooth. So the next step is actually going to be etch. It's going to come in a syringe like this. That black tip on the end is actually disposable. You would take that off and put it in the sharps container in between uses. So etch is an acid. So you are going to put that, that acid is going to be right on the tooth, but you have to be very careful that it doesn't touch any gum tissue. Then you're going to let it set for 10 to 20 seconds depending on what that manufacturer recommends. And then the assistant will use the air water syringe and the HVE and very carefully remove that etch. Now we need to do a bonding step. So you use that little blue micro brush, that disposable, and you're going to put a drop of that bonding into a disposable well. And you want to be careful. This little bottle is upwards of about $100, so you're only going to use one drop. If you need more, you can always get more, but one drop. And then you dip the micro brush into it, and then you give it to the dentist. After you do that bond, you need to light it up. As we say, we're going to use the composite curing light. Kind of sounds like a hair dryer, and that is going to be used to set that bonding up. Now, this is where there's a couple different steps. If it is a very shallow occlusal cavity, we can use what's called flowable composite. Comes in a little syringe like that, and it's just liquidy. It comes out and can be put right in the grooves of the teeth, wherever that cavity is. If we use flowable, then you pass that to the dentist, and then you use the curing light again. And that sets it up. If we need something a little bit more, we will use original composite in the composite gun. And that little colored on the end, that green and yellow, that is disposable, and it has whatever color or whatever shade composite you want for that particular patient. So I'll show you the shade guide shortly here. But once you get the composite, you give it to the dentist with the composite gun, and then they will need to pack it in with the plastic instrument. My plastic instrument is black. That's how you're going to recognize that one. It looks like a hockey stick and a plugger from like amalgam. Then you have to set it up. So we need to light it with the curing light. Again, the assistant is the one that's actually using the curing light on the tooth. Next step is to put some anatomy back into it. You can't do very much because you can't carve. So that's when we're going to use the high-speed handpiece, and that means you're going to have the HVE. Once that's done, we want to check the bite. So we'll use that articulating paper holder again. If the filling is high, we need to go back to that high-speed handpiece, which means you will go back to the HVE. If we've tested it once, we'll always test it again, so then you know you're going to need that articulating paper back again. Once it's all good, then we're going to smooth and polish it with the slow-speed handpiece and the polishing discs. They're kind of like sandpaper, and there's different grits on them, so there's different colors. So we're going to use that to make it all nice and smooth. Then you give the patient a final rinse, and at this point they can eat whatever they want. I mean, if they're numb, then they have to be careful because they don't want to bite their lip or their tongue, but other than that, it's as hard as it's ever going to be when they leave. And that is Composite 1.